We're going to call this regular meeting of the school board to order. Please rise for the pledge. And first, we'll do a moment of silence. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. We have a lot of polls. Do I have a motion to approve the agenda with items 4.05 and 5.10 added, 15. Did I say 5? I meant 15.10 added, 15.08 updated, 3.01, 2, 3, 4, 5, 4.01, 2, 5.01, 3, 4, 5, 7.01, 10.01, 2, 12.01, 2, 3, 4, 5, 6, 7, 8, 9, 13.01, 15.01, 03, 04, 05, 06, 09, and 17.01 removed.
So moved.
Second.
I have a motion by Ms. Roberts, a second by Mr. DiTerlizzi. All those in favor?
Aye.
Aye.
Opposed? Motion carries unanimously. Are there any pulls from the consent agenda?
I would like to pull 4.02. I'm sorry, not 4.02, 4.04.
4.04.
I have a question about that.
Okay. Any other pulls? So do I have a motion to approve the consent agenda?
I have a motion to approve items 4.03, 4.05, 5.02, 6.01, 6.03, 7.02, and 9.01.
Second.
I have a motion by Ms. Roberts, a second by Mr. DiTerlizzi. All those in favor?
Aye.
Opposed? Motion carries unanimously. Let's go back to 4.04.
I just have a question about that. It's not going to change anything, but with the number of teachers leaving the district that are separated from the district on this agenda, including 3 at Hidden Oaks and 3 at Anderson Middle, have they been afforded the opportunity to complete exit interviews? And if so, how is that being done at this point?
That would be a question for Ms. Gaylord.
Is that on 4.04?
Yes.
I only see
There's only one leave on that.
Those are just out-of-field notifications.
Oh, I'm sorry.
I think you pulled the wrong one,
I
but
pulled
it's
the wrong
okay.
one. I
Yeah.
apologize.
It's further.
But there's one coming up.
Okay.
So if you want to go, do you want to go ahead and approve that one? I think the other one is the addendum that's on the regular
Yeah,
agenda.
that's my fault.
Okay.
You want to move approval of?
Move approval of 4.04.
Second.
I have a motion by Ms. Steffenthaler, a second by Mr. DiTerlizzi. All those in favor?
Aye.
Opposed? Motion carries unanimously. Okay. We have no items for board member discussion, no information share items. And just so the public knows, if they're watching this, is that we really shortened this agenda due to the fact that we, the circumstances that are surrounding us right now. In the future, I know the superintendent is working diligently to have these meetings set up teleconference so that we will be participating, and then there will also be the opportunity for the public to participate in that process by telephone, which is similar to what is going on around the state, given the pandemic that we're experiencing right now. And we will, as even on those calls, I think it would be good practice to keep that to absolutely essential items that we need or we have to have approved, just because we know it's not normal, and we want to encourage public participation as much as we can. So I think everybody's going to be learning through this process as we move forward. So as much as we can keep essential to the operations, I think that's what we'll continue to do moving forward. Okay. Sorry. We have open to the public. I don't know if there's anybody from the public who is here that would like to address us before the time certain, because we're going to kind of get into other items outside of the consent agenda, please. And then we'll have a time certain at 5 o'clock as well.
I don't have an attachment in my agenda for 1502. It's an action item with no attachment. Was there an attachment to that?
No, we're going to talk about that one separately, which we will,
Okay.
I didn't even think about an attachment for that. But it'll be fine. We can just have the discussion. You don't need anything.
Okay.
Yes.
Hi, Karen Ressiniti, President, Martin County Education Association. Didn't know how you guys were going to pull this off today, so it's good that we were able to get together. Just briefly with virtual, yesterday was kind of stressful for the teachers. I had teachers dropping off ballots for contract ratification, and they almost couldn't speak. They were just so overwhelmed, and I'm trying to tell them to calm down. But they're getting so much stuff thrown at them. And, you know, one girl's just trying to figure out her platform and how to do Google Classroom, and you know, she's getting model lessons. Look what someone from Hidden Oaks did. And I said, you know, they're just trying to help, you know, by sending you something so that maybe you don't have to reinvent the wheel. I get that. But when you're on the computer and there are 12 videos, and, you know, I'm just asking for flexibility. I already talked to Dr. Featherstone. I've been in contact with Tracy Miller. I've been in contact with Joe Rodowitz. I just don't know if anybody realizes how overwhelming it is. My head is spinning. It's spinning. So I'm asking for flexibility. As far as the health insurance is concerned, I came in on the last couple of meetings, and I know that unanimously it was passed to go to a 4-tier. I think it was 11 to 4 to stick with Florida Blue. I think 3 of our MCA representatives went with Cigna because it had a much better savings for everyone. The complication there was pharmacy. To me, it was unclear whether the pharmacy was a matter of paying $5 extra a month for a prescription, or whether you couldn't get the prescription at all and had to go through the process. Personally, I think the process is way too fast, and people don't have time to even think. They're being asked to make decisions with all of these numbers. But of course, there are many angry people because of the family insurance plan going up so much. It varies according to HMO, HDP, but it's between $176 to $230 a month that people would go up. You know, you could have a young teacher, 30 years old, with 1 child, and her spouse paying way more than a parent who's maybe 50 with 4 kids, and the spouse is able to get insurance somewhere else. So they're still getting more people insured, and they're saving like $279 a month, whereas the family, you know, the total family is going up $188. I know it's a difficult thing. We cannot have a different insurance policy for everyone. I get that. In Palm Beach County, they have district contributions leveled. Just briefly, $6,300 for employee only, $9,700 for employee plus kids, $9,900 for employee plus spouse, and they give $12,960. Briefly, I don't think that they should redo it and have these people who have really kind of subsidized the whole family, because all of those other levels have been paying more. However, if the district contributed $1,200 per family, those people who cannot get insurance any other way other than have the group family, it would cost the district $288,000. We would probably have to sign an MOU on that, which I would be willing to do, and perhaps moving forward into negotiations, we can come up with a plan where it's leveled the way they do it in many other districts. We've been frozen with contributions since 2014 at $6,500, and now it's really, taking a toll on everyone. Thank you.
Thank you.
Wow.
Was there anybody else out that wanted to?
Yes, there's a gentleman.
Okay. If they're ready, and, they might as well talk now.
Can you read the name? Nicholas Berkeley. Nicholas Berkeley, would you please come into the meeting?
Did they hear that?
Thank you.
Hello.
Okay. Good afternoon, everybody. Thank you for seeing me today. I come to you today not as as a frustrated teacher, a parent, and an active voter in Martin County. Not just because of what's going on around us with this coronavirus, but because of the value of family that apparently means nothing anymore to anyone. You see, for 3 years, the insurance committee, the Gehring Group, and the purchasing department have been attacking the families in Martin County by trying to implement a healthcare plan that will penalize families at the benefit of single individuals and single parents. The current plan up for adoption appears to be a major cost savings to the district. I'll give you that. But when you look at the numbers, the insurance prices dramatically increase for families, and especially the two-employee families, which create a very good sense of community, I feel, in this district. If you have 2 employees, for example, my wife teaches at an elementary school, I'm at a middle school, those kids are familiar, they know me, so when I get there, or when they get there, they have a familiar face to call home. So, and that's something that I think is very important to Martin County. Now, back to what I was saying. The rates double on some of the plans, and this impacts more people than are actually helped by the employee and spouse or the employee plus children plans. Not to mention any possible changes with what's going on in our economy right now, and people that, as Ms. Resinidia mentioned just a few minutes ago, the single employees that are on our roster as single employees, but if it goes off of, let's say, their spouse is insuring the rest of the family, and that person gets laid off, what are we going to do then? Those people are now facing a significantly higher insurance price. So what is the reason for this? Why is it that we're constantly having the same discussion every single year? In 2018, Commissioner DiTerlizzi condemned this very same plan that was introduced in hurting families. He instructed the purchasing department and the insurance committee to reach out to the Martin County government, who he has experience with, in order to see what we could do to work in coordination with them for a plan that would be significantly better than what we are currently being offered. Is better coverage for families and 1/3 of the price. And you can look that up on the county website. $293 a month for a family, 1 employee. And it's better insurance, 0 deductible. In 2019, the board gave the same instructions to send this insurance out to bid or to try to implement self-insurance to get us a true cost savings. But instead, here we are again with the same 4-tier plan, trying to pass this plan off as though it's the next best thing, and the school system is trying to pass this plan off on teachers under the cover of quarantines and hundreds of emails that have been clogging their inbox for the last week and a half. So in Martin County, where I grew up, family was important. Teachers were respected and character mattered. If that's still the case today, I respectfully urge each and every one of you to reconsider this plan that has been repeatedly forced down our throats and come back with something that's more equitable, or ask them to come back with something more equitable. Thank you for your time.
Thank you for coming.
Thank you.
Thank you. Is there anybody else out there that?
Those are the only 2 that can.
So I honestly, I think that, I don't know when we'll get to that item, but I think we need to wait until after 5 o'clock, public comment, just in case anybody else comes that wants to speak to that item, because I think that is probably the most controversial thing we have on this agenda, and I have a lot to say about it myself. So, if that's okay with the board, we'll move on with some of the other things.
Madam Chair,
Yes.
I left my insurance, that book on the insurance options in my car. Do you mind if I go get it?
No, please.
Thanks. I'll be right back. I'm on the out front.
Should we take a quick break?
No, you can keep going.
Okay. So, well, Mr. DiTerlizzi the next item that is on the agenda for action only is the alternate appointments for board committees. And we're really only going to take up one at this meeting because it is timely. And it happens to be the Value Adjustment Board, which Mr. DiTerlizzi is the prime person, but we need to have alternates. And Mrs. Gaylord and I were talking, maybe we should do it in that we identify everyone as a first, second, third, fourth alternate. That way, if there ever is a time because they were trying to meet and couldn't get a quorum, and we did not have an alternate listed that we voted on, and it has to be voted on by the board. So,
And I want to thank Ms. Stephenthaler for
Yes.
offering to attend that meeting, because she was willing to step up, but because they hadn't been approved, that's why we were unable to do it, so, but thank you.
yeah. So we need an alternate, and we can do a first, second, third, fourth, so everyone is an alternate, and they'll just work down the system until they get someone. That way, we voted on it, and,
Madam Chair,
yes.
in about 20 years being on that board, that was actually the first meeting I missed. So generally, you'll probably, good Lord willing, will never have to attend, but there was no way I could do that.
Yeah. Well, things happen, and obviously other members weren't able to attend either. So if we have that system in place moving forward, we'll be able to, prevent that so that, if they need a quorum, we'll at least be able to step up, hopefully. Ms. Roberts?
Thank you. Will we have to go to training, though, for that? I know that there's training for the Value Adjustment Board.
No, it's really easy. I mean,
No, I understand that, but there is a training session for that, so should the first couple go to training, I guess?
So is there anyone, I know, Ms. Steffenthaler, you were approached by the superintendent. Are you, anybody, or do we have volunteers, I guess, to be the first alternate?
How often is that meeting held? It's not that often, is it? Yeah, I think so.
depends on how many, Madam Chair?
Sure.
It all depends on how many petitions are approved to go before the board. Usually, I think it's 3 to 4 meetings. I don't think a meeting has ever really lasted more than an hour, maybe an hour and a half. Usually, they're 30-minute meetings. I think sometimes it's hard to, you have an organizational meeting, and then you're given your list, and they generally aren't very long, and they generally aren't very often.
And they're during the day, Mr. DiTerlizzi?
They're 9 or 10 o'clock in the morning,
And you know the dates ahead of time?
well in advance, yes.
I don't mind putting my name on the list.
I don't
Okay.
mind either. I would like the training if there's something I need to know before going, so.
Okay, so,
I can be on there too, it's no problem, as long as I know ahead of time. I think it was the,
okay, so
Okay, Bible study.
who would like to be the first alternate
I don't care.
between the two of you? It doesn't matter.
Rock, paper, scissors?
I want to be the first alternate there.
Okay.
Solve that problem.
So do I have a motion to, Mr. DiTerlizzi obviously will remain our primary person. Ms. Roberts would be our first alternate. Ms. Steffenthaler would be our second alternate. Mr. Anderson would be our third alternate, and I'll be the fourth.
So moved.
All right. Do I have a second?
second.
I have a motion by Ms. Steffenthaler, a second by Mr. Anderson. All those in favor?
Aye.
Aye.
Opposed? Motion carries unanimously. It's like throwing me off because I usually have to kind of look at everybody's names, and it's like, yes.
So, for the training, I know that they offer training, but I know that in the past too, like, if you're unable to make that training, sometimes at that actual day, they'll give you a very brief refresher, and you're able to pick up from just that. So.
I think the training is in the summer, right? Late
Well,
summer?
and it's in advance of the,
And so then you all will advertise that if we're all going to be there, whoever is the alternates. Right? Right?
Yes.
Yeah,
Thanks.
we'll need to know.
Okay, thanks. And as soon as you know those dates, if you can let us know those so we can, thanks. Mhm.
Okay, the next item is I think this is the one, Ms. Steffenthaler, that you wanted, 15.07.
So do you want me to repeat my question?
Yeah, I noticed that too, there is a lot.
So I'm just asking, I noticed that there were 3 Hidden Oaks Middle School teachers and 3 AMS. I mean, there were quite a few separations. But for teachers and anyone really, what is the process for them to complete an exit interview? Are they still able to do that? What's the process, and when do we see those exit interviews?
So I know that everyone's afforded the opportunity to complete,
Are they online? Because I was hearing that
Miss-
there wasn't an opportunity, that's why I'm asking.
Ms. Gaylor, can you use your microphone?
yeah, it's kind of scratchy, that's why I turned it right there. Can you hear it now?
Yeah.
Okay. So in the past, I know it was available and it was online and everybody had that opportunity. So if it's not available, I was unaware of that. And so if you're saying that it is
Someone
unavailable,
told me, so if you could check on that.
okay, I'd be happy to.
And then when do we see the results of the exit interviews as board members?
So I think if you
They'll be on.
meet with Mr. Bonner,
Mhm.
he'd be happy to share that.
Ms. Roberts, you look like you have a question?
So we used to have those attached, remember? Those were
Yep.
like an information-only report. Is there a way we can do that?
Would that be each month then?
As he gets
Yeah.
them, yeah, that would be what.
Well, as, you know, and we probably need to make it a good practice that they're actually being done.
Right.
I'm not exactly sure why they stopped. Do we know why they stopped?
I have no idea.
Okay,
I wasn't aware that they had stopped.
okay.
I think maybe one of the problems, I don't know, I'm just guessing, what do I know? Every now and then, you will get what I call a disgruntled teacher. And if that's the case, then nobody's any good, everybody's bad. But I said every now and then. And I think what has happened, that kind of negate or water down the real truth from those, you know what I'm saying, when you cry wolf eating the sheep, and it's really not always happening. But sometimes it happens. So I think because of that, you know, there's always a few that make it bad for those that, but I think there's some things out there that we just need to know. But I think we all can kind of figure out those that are sour grapes, and you know, sometimes it's hard to separate it, but I think it's good to get an exit interview. Not just because it's the school district. I don't care wherever, because there could be some valuable stuff there. And also, if you begin to see clusters or patterns of the same song being sung, then maybe, just maybe, you need to pay some attention to it.
It's valuable for recruitment,
Yeah.
retention, and yes,
Yes.
you're right. So we'll be seeing those then once each month?
I
then?
will speak
Okay.
to the HR department. Thank you.
And are you saying, Mrs. Gaylord, that I can contact Mr. Bonner, or are you going to let me know whether they're being done, so I know?
So I can
He
check
has
with
to-
him to see that they're being done, but I was going to say if you would like to speak about something in particular,
Okay.
you know, if, you know, you want to let me know if there's something in specific that you need to speak to him about with them. I do know that in the past, when they were posting them and attaching them, the majority of them were negative, and so I don't know if, I did not know that they were not completing them. I think that Mr. Anderson's right, that if you see a pattern of, you know, you say that there's 3 people leaving here at Hidden Oaks, so they're resigning. And so, you know, we look at retirement's certainly different than
Yeah, I was
resignation.
thinking of resign.
And so resigning, and so you say, well, you know, why is there a separation of 3 people at the middle of the year at Hidden Oaks Middle School? So that would be something that we would look into. I would hope, I mean, I wish, and I think that opportunity should be presented to employees, for more employees to say, you know, we would like everyone to fill out an exit interview when they leave and depart, because not all of them feel negatively about the district, and there's reasons why people leave, you know, at any given time. So I think that the encouragement to have people that are separating from the district to fill them out, I think that
Right, I agree. All
will
of
be reiterated back to the HR department.
Great, thank you.
And those don't necessarily, we had talked, oh, sorry, Mrs. Roberts. Go ahead.
Thank you. So I did notice that on the list, there were 26, if you add the ones from the addendum, teachers that were leaving. I did note that most of them were leaving the end of May. So it wasn't like they were, even though they're resigning
At the end of the
at the
school
end
year.
of the year. It appears that the ones that are resigning that aren't retirements, if you have the 26, it's 12 of those that are resignations as opposed to retirement. So even though 26 seems like a big number, a lot of those are retirements, and it's really only
Right, didn't look at
12.
retirements, right.
Yeah,
I was
it's
just looking
12
for-
that are resigning, and the bulk of those resignings are leaving the end of,
Right, and I didn't say in the middle of the year.
yeah.
Mrs. Gaylord said that.
Yeah, but I mean, just
Yeah,
so
but
that we
I know what
know,
you're saying.
you know, because it's something that if they know, I mean, and I don't even know the years, we see these, for instance, teacher at Hidden Oaks Middle School who's resigning after 24 years of service, so we know that in resigning, she's not going to get the stipend for coming back the following year, because she's not retiring. You know, so it's kind of, I don't know what the individual circumstances for that. The bulk of the ones that are resignations do not have the high years of experience on them. It seems to be the retirements have the higher years of experience than the other ones. But yeah, I think that it's,
I just want to know why people are leaving.
yeah, but I mean, I think it is good that they're waiting until the end of the year instead.
Well, and don't let the end of the year fool you. It just makes sense. You're so close now, it's a clean break.
Sure,
You know,
yeah.
yeah.
Well, and they put their notice in now, too, to make sure that they're putting in their 90-day, so,
Yeah.
For the retirements, yeah.
yes.
Retirements require 90 days, but, yeah. Okay. So,
Need a motion to approve 1507 and 1510?
I have a second.
Second.
I have a motion by Ms. Roberts, a second by Mr. DiTerlizzi. All those in favor?
Aye.
Opposed? Motion carries unanimously. Okay, so now really all we have left is open to the board and then the discussion on the insurance. How would you all like to do that? Do you want to, I have just if you have any comments that you would like to make open to the board, we can do that now. That way, if there's things, we can talk about our future meetings and kind of what you all see in that.
If you'd like to give me to give a little update about our food program, I can go
Sure.
and do that now.
Okay.
So food meals started yesterday, and yesterday's count was at Warfield Elementary School, 146 meals. Port Salerno Elementary, they were lined up at 9:15, waiting, and they delivered 232 meals. J.D. Parker had 110 meals, and Hopestown Elementary, 292 meals. There were 200 meals that were delivered, that Boys and Girls Club delivered into the community, into the mobile home parks, and also over to Banner Lake.
Just in Hopestown, 200? Or is it in all of their
Well,
facilities?
I know that they got 200 meals, and I was under the assumption that it was just to Hopestown, but I will clarify that.
That was the Boys and Girls Club?
Yes. Because I know that that was for the breakfast and lunch, and I know that they're providing the dinner program for their 4 locations in Indiantown, Salerno, Hopestown, and Palm City. So that Boys and Girls Club are providing that on their own.
So Boys and Girls Club delivered 200 meals for the school district?
Yes.
Okay.
For the school district or for their program?
For the school district.
Oh, so in addition to these, there were 200 additional ones they delivered?
Well, and that's a note that I have for myself, is to make sure, like, because I don't know that, 292 at Hopestown Elementary, that would only be 92 families that came there. So if the Boys and Girls Club is delivering the most of those meals, so
Oh, so we think the
Yeah,
200 might be part of the
it
292?
might possibly be part of it. I'm not exactly sure. But again, for today's count, there's, again, a 292 at Hopestown Elementary. It's the same number as yesterday. So,
So I think I shared with the superintendent too, one of the neat things they're doing in Jackson County, which my sister happens to be a teacher there, is the bus drivers and the teachers they're going the bus route and delivering meals to students that would not be at their normal bus stop. And it was really kind of cool. I thought that was nice. I don't know if that's something, it just seems like a lot of kids don't have especially those that ride the bus, can't get themselves during the day, and especially if their parents are both working or they can't come with another person, having an adult with them that walks or rides their bike. I just thought it was a really neat idea.
So they're taking them to the bus stop, you said?
Yeah, teachers were on the bus, and teachers would hand out when they got there to the kids, because they know the kids.
Right.
And the bus driver drove the bus route that they would normally drive. So I just thought that was really a neat idea. I just think we have a better opportunity of serving more kids that way, making sure that they have a healthy meal.
So today's count at Warfield was 199. Port Salerno was 267. J.D. Parker was 230, and the 292 at Hope Sound. So you can see that there's an increase at each of those sites, and that will continue through April 15th.
How many were at J.D. Parker?
J.D. Parker, 230 today.
So when the children are learning at home, they're going to go during the middle of the day to go pick up their meals? If it's continuing through April 15th?
I guess so.
What were the first two again, I'm sorry?
Warfield, 199,
199?
and
How's that going to work?
And the second one was?
It's their related art period. No, I don't know.
Okay. Because if we continue the meal service, right? But if they're doing virtual learning
And they have to be present.
and they have to be present for their meal, I don't know
Well,
what that does.
I don't know an alternate time for them to pick up the meal at this point in time. That includes breakfast and lunch.
Is there a way maybe that the bus drivers could do a delivery?
That's a question that I need to go back and ask.
I mean, if the bus drivers could do some delivery, then at least you don't have somebody who's learning at home on their computer having to load up the FAM in the car and drive to the pickup site and get your meal and then drive back home and turn your computer back on.
yeah, okay, kids.
Eat in the car, quick. Thank you.
Okay, and the laptop delivery also starts tomorrow. So they do have to go to the school to pick up their laptop, but that will only be one visit required for that. There is a whole schedule about when kids need to go, and so we've been trying to push out updates every day for families to be able to keep up with the information that's coming out. And there is a schedule slotted for them at grade level for them to pick them up.
I did ask, and I think that she answered, families that have more than one student at a grade level, rather than having to drive there 2 or 3 times, they're
Yes.
able to pick them up at
Yes.
the same time, right?
Yes, they can. And so, looking at that, and we're pushing for students first. So we want to make sure that students have access to computers, all students first. So if there are extra computers left over at the end of this, some teachers have requested that if they're working from home, and they don't have a device, we're looking at providing that for a teacher that may not have any device at home. So that's the laptop distribution. Students that have the laptops in high school, if they have a broken or malfunctioning device, they should bring it in and we'll trade it in for a functioning device. We did learn of some students that we heard from somebody that had a malfunctioning device or an inoperable device since February, but we didn't know about it until this week. So we encourage them to make sure that they get a functioning device. Instructional Services Department's pushed out some videos, and I do agree that people, this is a changing time for all of us, and probably there's many people in this room who remember when you were a kid going to school and getting a shot and receiving a vaccine at school. The majority of parents that are parents today in school, they don't remember those days, and kids today certainly never remember that stuff because, they've had in their life immunizations that have kept some of these things and children from being sick. I mean, if you remember measles, and there was a measles epidemic, and I mean, people died from measles. And so fortunately for all the kids today, especially, you know, even my own children, I look at that and they've not experienced anything like this. So, but the people that have stepped up to the plate to be able to do the job. And I was at Hopestown Elementary yesterday, saw the teachers in their classroom working, and, you know, they're working together, spaced out, social distancing, and we're, you know, all following CDC guidelines everywhere. But, you know, really, you know, collaborating, working together, posting videos. I went in one room because I heard them singing and wanted to see what was going on. And so, you know, there are a lot of good things happening. I think that there's help there for those people that need the help, and they just need to ask for it. I think with everybody posting is good ideas. It's not saying, oh, here, you have to do it this way, but it's giving some of those people that might need a little extra help some ideas about how they can deliver this instruction. And this is not an option. I mean, this is the way instruction shall be delivered. I mean, Department of Education has this expectation, and that children be able to receive their virtual education. So we will deliver the best that we can.
So are we using Zoom?
What are they using, Ginger? They're using,
Everything is currently being run through Google Suite, so anything within the Google format. So it might be Google Meet, Google Hangout. We've all been learning very quickly what that means. So now all of our meetings have been through Google Hangout. But there's a variety of different resources that they're using based on what the teacher prefers to use.
So is Zoom compatible with that? Because I know most of the other adjoining districts are using Zoom.
Currently, it's our desire to stick with the Google platform right now because it's something that we host, and it allows for everybody to be on the same page for training. As far as Zoom, we do have a Zoom that we have used within district, and we've discussed if there's a need for us to look at it. But for right now, our ultimate goal was to roll out the plan as it is, give us a shot at it for a couple weeks, see how it's rolling, and then see if there's a need to address other avenues that the teachers might want to look at as well. Right now, most of them, there are many who are very technologically savvy, so this has been an easy transition for many, and for others, it's quite a learning curve and a learning experience. So it's really great. I learned how to Google Hangouts, so I was pretty proud.
I have a question. If you have multiple students in a household, like 2 middle school students in the same household, are they going to get 2 different computers or just one?
They will be afforded the opportunity to have a computer each, as they may have to be doing assignments at the same time and can't do it on the same computer.
Well, they're very fortunate, because in Palm Beach County, they're getting 1 per household.
Correct.
So they're very fortunate.
and I know I spoke to someone in Palm Beach County today, and they are looking for 40,000 devices. And they are being told that the Dell one that we are using, it's a 12-week wait time now, and then the second choice, it's an 8-week wait time.
Yeah, I know a lot of school districts are pushing back their start because they are not technologically ready to give that instruction to, especially to kids that do not have a device at home, or families that don't have a device at home. So,
And all this when the digital categorical was
Yeah.
Going away.
chopped. Telling somebody that
chopped,
today.
yeah.
Interesting. And I tried to put that on a
Sorry.
slide, but I didn't have much luck, so
Just
gonna ask
wave
the
me
question.
down, because this is weird and different. I feel like it's more like a workshop setting than it is a board meeting, so.
So, and you all may be doing this, but because Mrs. Resiniti mentioned about how overwhelmed the teachers are, maybe if we're sending things out, we can send them out with encouraging words. You may already be doing that, but I can understand how they're overwhelmed, because I would be overwhelmed at this point, being a teacher, not as tech savvy as some. So any way we can do to support them and encourage them, and let them know that, and I know you're letting them know that the district's there for them, and it's overwhelming for all of you too, but anything we can do.
I will promise you that we are sending those. I'm even sending Pooh and Tigger as my virtual hug when I send those out. And the instructional team has done a phenomenal job. George Vogley led the path and has created resources, and it truly has been I call it a work of art, what has been produced, and there isn't one person that hasn't jumped in to make sure that we're doing what's best for kids first. And I think that's the most important part of this, is that it's about the kids. And we all worry about the children that are sitting at home, that maybe mom and dad have to work, and it's going to be difficult for them. So we're trying to process through that, what that looks like. How do we support them, knowing we can't meet with them, we can't do this, you can't do that. But again, I think the most important thing is what does the next week, 2 weeks look like? How do we forge through that? And every teacher's been provided additional support and learning opportunities, and sites are even open, and we have district staff that's there to practice with them. We even have Google Hangouts for leaders, because as you know, some leaders are here with technology and some are here with technology, so we have to bring all of us, a little bit around to where we need to be. But that is something I think we're all very cognizant of, and being aware of how important this is too, because this is something that we don't know what it is and where we know what it is, but it's kind of such an unknown in the change in the path of where we're going as a state.
Right, thank you.
Yeah, and I think a lot of it too is about flexibility, and what we think is a good plan today might not be really how it works. And when they start implementing it, that we reevaluate that the traditional schedule that a teacher keeps might not be how it works in reality. I just envision that being a little bit different, especially for high school kids, and even kids whose parents work. They may be doing their studies after 5 o'clock in the afternoon, so it's going to vary, so that we're flexible with teachers and their schedules and how they're clocking their time, and that they're actually working when the students need them to be working, and not we're going to come in at 7:15 and you're going to work until 3 or whatever the hours are. And that we are flexible in that way, and they're meeting the kids where they are, and the parents too, because it's going to be a real learning process for parents as well. Ms. Roberts.
Thank you. Have we identified dead zones where there's no signal?
They've been working especially out in a couple areas that teachers have identified as a need, because they have limited access as well. So we're working on that, and the title department's been working on that as well. And they are working diligently to see what we need to do to help, and we've been partnering with the communities as well, because they actually know better than we do where some of those difficult spots are and what we need to do for that. Today I actually reached out to the Stewart, the 10th Street Community Center, to talk with them about communicating with their families that come there, and opportunity to let them know, and if there's something that we can do to support students that come in there once they open their doors again, we're happy to do that as well. So we're working with a lot of the different organizations in the community, because as you all have said, what happens Monday is all new and will be an adventure. And I'm hoping that at the end of this, that we come out knowing that, wow, this was not only an opportunity, but really a great opportunity.
Mr. DiCerlisi? Sorry, Mr. DiCerlisi had his hand up, and then I'll come back to you.
Thank you, Madam Chair. I spoke with Mrs. Falls this morning because I had some constituent questions about parents being able to understand what's happening with the digital learning, because they don't know what to expect or how to log on or any of that. So Mrs. Falls informed me that they will be doing some tutorials for the parents, for the students, for everybody, and there'll be several videos out there online, and I think that's important, that, and I appreciate that from staff and Mrs. Gaylord and staff to do that. It's important we get that information out, because there's a lot of people very nervous about this right now.
I can assure you that parents are more nervous than the kids.
Oh, they are. They are.
And I
No,
think
but there is
teachers
a-
are too.
There's also a plan for students that when a teacher does not log in, that if they see inactivity on a student, that there's actually a personal call that will be made, so that, to keep those students logged in. Also talking with Taryn Christopher from the county about the possibility of, they have at the library, not that the libraries will be open, but they do have a bank of computers that, if need be, if there are children in an area. I know in Indiantown, the children use the library in Indiantown a lot for the technology that's available there. So looking at that could potentially become a possibility. And those hot spots in the area then as well.
Mr. Anderson?
Yeah, okay, so what I'd like to say in the midst of all of this, I know that this is, again, is uncharted territory. I know that some people are a little apprehensive, a little nervous, whatever you want to call it. But from what I've been hearing, and I've talked with quite a few teachers out there, given what we're up against, I think the district has done an excellent job of getting information to them. The teachers have been very supportive of each other. There may be one or two, and I'm in the trenches with the teachers, but every now and then you're gonna get some drama out there too. This stuff is really not rocket science, and the kids know the computers. And I'm gonna tell you something, the teachers are rallying together and they're supporting each other. So if someone got a problem with the system, there's all kind of help out there, and it's not that hard. I know how to do it, so I can tell you it's not that difficult, okay? So let's just keep that in mind. Just because we're up against these things, we gotta, based on what we're going against, I think we're doing good. And we can't overshadow that, man. You guys are doing very good. I mean, nobody knew this was coming. It seems like a dream. It really does. But I'm proud of the way we've handled this. I am.
Well, I echo what you say. The district has done an amazing job launching this. And I know a lot of the, some of the drama that you talk about is really nervousness. It's trepidation about what's going on, not just at school with their kids, but in the world. And they're worried about a lot of things outside the classroom that, I think that I experience it at my job all the time. Everybody's nervous. Nobody knows what to expect. So I think it'll get better with time, hopefully. But I think it's going to, we'll just be adaptable. That's the way to go.
Flexible.
Adaptability. Adapt to what comes your way. Ms.
So
Stephenthal?
I'm just trying to envision, Mrs. Featherstone, because I haven't really used Google Hangout.
Will you use your mic, though?
Oh, I'm sorry.
Yeah, because I
Is
can't.
it not working? Can you hear me now?
Yeah.
Okay.
It's better.
When are teachers meeting with individual students, or can the class see each other at the same time when a teacher's meeting with them? How is it working? Because people have been asking me that.
It depends on how they choose to use it.
Okay.
So I could do a Google Hangout with one person if I wanted. I could do my Google Hangout this morning. I had 10 people in there. We can see each other unless we, of course, turn the video off, which we have that capability as well. So I could do one-on-one conferencing. We also have an additional program. So, for example, we built out a continuity plan for social service workers as well as our prevention intervention program specialists, and all of them, they all have their own. So with the social service workers, they have a different platform that we are using, which is similar to what Tykes and Teens uses. It's actually the same program, which allows them to be able to communicate one-on-one with the students. And as we know, we can't violate HIPAA. So that's something that they have that ability, and it's a confidential ability for them to reach out with their children as well. One of the things I'm really excited about is one of the schools has a restorative circle group that might need a lead. So I offered to take on one of the groups of students and be the communicator for them weekly, just to check in and see how they're doing and connect with kids. So I'm really excited about that opportunity. So it basically meets the needs that you're looking to use it for.
So for the teachers in elementary school, are they being told how to do that as a
Yes.
class? Okay. So are they meeting as a class, or they're meeting?
It's their discretion as the
It's still
teacher.
their discretion?
Yes,
too? Okay.
ma'am.
I just want to make sure when I answer questions that I know.
Yeah, if you've, I'm sure you've received a copy of the continuity plan.
Yes.
So if you go in, each one of those has a link
Okay.
that has a tutorial that the IS department has built and done. All of these as well, anything that we're going out to the public, we're doing in Spanish as well as in English. And last night's version of the parent video was really fabulous, and Mrs. George did a beautiful job with her Spanish version. So it allows them to also, we have translators if there's a need for them to have translators to communicate with their students, especially Warfield has a lot of that already set up, as well as Port Salerno. So those are based on the teacher and what they believe they need to do, and then the paras are going to be supporting them.
And it's 8 to 3, but there's flexibility in there, correct?
It's completely flexible with the
Completely
teacher's needs.
Okay, good. I just wanted everybody to hear that. Thank you.
And again, if I could say, some of them are making a phone call or emails, and they're getting it. I'm telling you, somebody called me and asked me, "How are you doing?" And I said, I'm good. You know how? Yeah, I can teach you. What? You can teach me? Yeah. So, I mean, people are there to help. Tough times bring people together. And so we don't want all of this. It's a shark, but we don't want this to overshadow. There's some good things coming out of this. And I'm telling you, I am really proud of how the district has handled this. Never in my wildest dream I thought it would go this smooth. So, I mean, it's going to be okay. It really will.
Okay. Ms. Gaylord, did you have anything else?
No, that's all for right now. Just keep plugging along.
So we're just about 8 minutes from the 5 o'clock for public comment. Is there anything else from the board that you would like to discuss or go over? I just had one thing. One of the things that we have coming up is we had an employee hearing, March 30, 31. That obviously is going to be, I don't know how we're going to do it.
That's still on, right?
Madam Chair?
Yeah.
Okay. The employee's attorney has indicated that they are available and ready to go forward if it's done in a manner that includes the social distancing. It's where I really need instructions because pursuant to the Florida Supreme Court, the 19th Circuit, the court system that we live in, the 15th Circuit, which is Palm Beach counties, have stopped all evidentiary proceedings because it involves people, it involves receiving evidence, until at least April 15th. There is a set of guidelines coming down through the federal court system that establishes a way to remotely, therefore something like Zoom or GoToMyMeeting, where people would be in different locations, and it would require a lot of coordination because all evidence would need to be sitting with all parties beforehand so that it can be, if admitted into evidence, everyone has the ability to review it. So it's not impossible. If this became an ongoing emergency as opposed to one that would be over in the near future, then I can tell you there is a way to do it. But I need directions whether this board wants to conduct it. It would need some time because the superintendent then would need to establish multiple places where witnesses could be, where we would all have the technology, if it was to be here, to see the witnesses, and all of us would be, whether it's in this setting or otherwise, separated. So it can be done. Our court systems have put a halt to their evidentiary hearings at this time, and I just need directions on how to proceed.
If we had to do it, could we not do it at a school site so that there would be more space to take into account? Doesn't have to be done here necessarily, right?
Correct. As a reminder, witnesses generally are excluded from the area until they've testified.
Right, so they're still.
So they'd need to also be in their area, separated. It can be done. It just needs preparation. And then if anyone is doing it remotely, the technology needs to be prepared in advance.
I think did I get an email from you, Mrs. Falls, about the meeting on March 30th or 31st? Special meeting?
We previously have had a notice. It was scheduled for both
No,
nights.
it was in today's newspaper, that's what I saw. Today's newspaper has a notice for that, but it only had one of the two dates. It didn't have both dates in there.
One ran yesterday and one ran.
Oh, okay, all right. Thank you.
So what's the pleasure of the board?
This has been going on since,
I will tell you what I know,
From
which is
January.
almost nothing.
Since January?
The alleged incident was in August. The first time it came in front of the board was during the Christmas break. The employee's attorney asked for a continuance. And that's where, as a school district, Mrs. Falls has a job to figure out how all of you all can be available for a special meeting. The attorneys had not coordinated dates. So there was a hearing set in January that the employee's attorney said she was not able to be prepared for, and you all at the January meeting okayed a continuance. That's the first that you've directly addressed it.
and the employee is at home, is not working, is working, is,
He is not working for the district, he is being paid.
We set those dates. I have no problem meeting the 30th and 31st, if that can be done within the specifications of how we can meet, but that's up to everyone else. I mean, I hate to put it off any further. It's been something that's, been sitting there for quite a while, but
Well, it's
I'll go
been
either way.
3 months, approximately 3 months that it's been out there. I mean, before that, but the first time the board has seen it was 3 months ago.
Right.
But it's been ongoing, from what I understand.
I have it blocked on my calendar, so I'm okay with it.
I just want to make sure that we are operating within the rules of the Department of Education and the executive orders that have been issued by the governor. So I'm fine doing it as long as we're following those guidelines and that that's acceptable.
And Superintendent Gaylord, I will need who I can speak to in the district to coordinate the multiple rooms.
The technology.
Yes.
Technology and facilities. So this would be for Monday and Tuesday of next week,
Yes.
because that's the 30th and 31st. Okay, so
Time is that?
5 and 4.
I think that will be difficult for us to pull together the technology piece at this point to, let me think about this a minute. To meet with the CDC guidelines in this room. So, and to also have the telephonic. So we would need to have, because I think that the attorney is asking to participate telephonically, correct?
No,
Oh, no?
no, she just said safely. That's it. Was, it just said, that regarding the client will be going forward, please confirm that there will be sufficient safeguards in place regarding social distancing. Distancing. Every court hearing I've had has been done telephonically or otherwise postponed due to health concerns. I just want to ensure safety for all. That was the communication that came from their attorney.
Okay.
And I'm not even going to read what the district's attorney sent back, which was totally inappropriate. Maybe I will, once you're done.
So is it, I mean, could we have the opportunity to be able to meet with staff tomorrow to see if we can get together all these moving parts by Monday?
Well, the advertising's been done, right?
Right, yeah. So the advertising's been done. But if we were to utilize this room and then some of the other rooms and witnesses and no more than 10, I don't know how many people are involved in all of this, so I need to get a number on this.
Madam Chair?
Yes.
And just so you all understand what I'm hearing, if it isn't able to happen Monday or Tuesday, what I'm hearing is that you all as a board, if the technology and the social distancing can be maintained, are ready to proceed forward as opposed to it being postponed until some point in the future where we're not in a state of emergency.
Yeah, and I agree. I think we should, if all the pieces are in place, if they can do it, let's make it happen.
And all the witnesses can attend.
Well, and
They feel safe.
And the employee's planning on it. So, I mean, I think it's, it was hard enough to get 2 dates that were next to each other to,
And then with everything coming down the road, since there's a lot of things we haven't been able to meet about, our schedules are probably going to be pretty full in terms of our agendas and all, so.
Is this meeting open to the public?
An employee discipline hearing is open to the public.
So we're going to have that factored in as well.
Well, we could do it, if we did it in this room, we could rearrange this setup and turn the room this way maybe, and have us kind of in a circle this way, and then have the podium over there, and the public could be outside, like they're doing in this meeting. They can come in and talk. I mean, all the technology is here already. For us to have to set up technology somewhere else, it just, yeah, with everything that's going on, I think this room serves a purpose. We just may need to move it around a little bit.
Well, we can't have more than 10 people in the room, so this is it, pretty much, in this room. That's all we can have. So we're going to have to, and it doesn't matter, we could go to a bigger site, but we still can only have 10 people. So it's this, if we're going to have whoever those 10 people are going to be, that's what we're going to have. Be able to accommodate in this room, or any other room for that matter.
So if there was public, there would be one room based upon previous employee disciplinary hearings. It's not heavily attended, but there'd be one room where they'd need to be able to view the proceedings. You would have one room where the attorneys and witness are, and the attorneys need to be prepared where all materials are submitted in advance, because multiple copies in different rooms where it may or may not be admitted depending upon how the proceedings go.
So if you're looking at something like a Stewart Middle School where you've held school board meetings before, and it does have multiple rooms and off of that auditorium, is what I'm thinking, I don't know why that would be a problem to set up.
Well, we have plenty of vacant rooms in this building. Every
Well,
room
you
is
just said
vacant.
that- But you said that only 10 people could be in here, so that's.
Only 10 people can be in any room.
Only
Right.
10 people could be in Stewart Middle School.
But in the auditorium, but then you have rooms off of it. You have the teacher's lounge there.
But we have all these too.
Yeah, and I have no problem.
Yeah.
What I'm saying is, Mrs. Powers just said that only 10, this is about it for here. So how does their lawyer come in as well as the person?
No, I mean,
I wouldn't be
Oh,
in
so you're
here.
not here and you're not here? Okay.
And Diane would be.
in here with your attorney.
Well, because we have
And Diane can turn things on and leave.
Okay.
seven,
I'm fine with
8,
that. I just.
9.
Diane can go to
It would be
that.
10.
No, because you have, so this is how it would be. And that's why this is tricky. Because you would have the 6 of you, then you would have the attorney, you would have the employee, you would have the witness, and.
their attorney, the
and-
employee's
and then
attorney.
district attorney, so that's 10 right there. So I would not be here. Ms.
No,
Ball
there would be 11. It would be 11. Because there would be the 6 of us, the employee, their attorney,
Well, I
and
can go sit in the room.
the superintendent
Well,
and
and-
their attorney, and then the witness.
And so you know, it is set up where board members can all be remote.
So we could
I
call
mean,
in.
It makes maybe a later phase harder to make a decision, but it
I'm not
doesn't
interested in that.
require the physical presence.
I'm not interested in that. I was like, I think when we're making a decision, we need to be in the room safely distanced from each other, but I'm not interested in doing it remotely.
Well, I think we could clear up 2 spaces if I went in that room, and Mr. Anderson went in that room, right?
I'll take one for the team, whatever it takes.
Sit in the,
And
sit
we
in,
would still be able to hear and everything, and we can participate electronically, but we wouldn't technically be in the room.
you just can't poke your head out and ask
No,
a
no, we
question or
wouldn't poke our
anything.
head out. So I think it's doable.
That's
I don't
not-
mind being in the back.
That's not
It's
gonna. that won't
doable,
fly.
and there's other offices that you all could also be.
Oh, and we have the camera guy too.
He's in his.
That's
room.
12.
It's a different room, if you ask me. He's got his own door.
When the hearings aren't on camera.
We don't have to video, we could audio.
Right,
We could
the audio.
But an
Somebody could
employee,
be in that room.
one of the board members could be up in there, yeah.
Yeah.
That's a different room.
So
For the
maybe
witness.
Superintendent could be
Or
in
the
that room.
witness.
Maybe I could sit in that room and run the audio.
So why don't we ask Mr. George to work with the superintendent to see if this can, if this is
If it can
possible,
work.
and then we can move
If we
forward.
can follow all the rules and get it done.
And it's really a logistics issue. It can be done.
And we just need to have that option too for the public to participate. Dr. Featherstone, will you please see if there's anybody from the public who would like to speak?
Yes, ma'am. Madam Chair, there's nobody to speak.
All right. All right. Are there any other questions, issues? I think the next meeting will probably, unless something drastic happens, major, we'll be in a position to hold it remotely and also have the ability for the public to participate in the meeting instead of coming here and physically being present. And I guess we'll probably have to have some sort of, unless, we have to figure out how that works. I mean,
A new case in Stewart tested positive. That's 5 positive cases in Martin County.
Are we doing 5.0, 15.08 now?
oh, shoot, I forgot about that. I thought we were going to get to the return now. Yep, 15.08. We're ready for the insurance people. Ms. Featherstone, I know we have 10 people, don't we? If,
I'm going to step out.
9.
so that Dustin and, yes,
Sessa and the Gearing Group can come in.
thank you.
And Madam Chair, if there's a numbers issue, I can step out too.
Oh, we're still at 9.
We're still at 9, so Dustin's coming in?
He was told he had to wait until Dr. Featherstone cleared the path.
Yeah, no, he can come.
Being very, very stringent,
Like over there somewhere.
but we don't have a piece of tape for him, so I guess maybe I'll have him stand here and
And
then.
over there. Like over there somewhere.
Come on over here. Wherever you like him.
He's 6 feet.
Next to the fire
But try not to hide behind the pole, how's that? Yeah.
Yeah, that's good.
Well,
Grab a chair.
we can stand. So good afternoon, Madam Chair, members of the board, Superintendent, Mr. George, and Mrs. Falls. As you know, I'm Julie Sessa, the Coordinator of Risk Management and Employee Benefits. And I'm here today to represent the Insurance Committee's recommendation. I know that we've met at a workshop. We've had some individual meetings with questions. And I'm here, and so is Dustin, to take any questions you might have. We do have some material to hand out that I can give you to supplement some of the other pieces. I know some of it was emailed to you today. Is it okay if I hand it out?
Yes.
Okay.
It's not included in the updated stuff? Do we already have it?
It is. I just wasn't sure who had it.
Who wants a hard
Opportunity to
copy?
print it.
Who would like to have a hard copy?
That's the recommendation memo,
What was that?
and then behind it is the material that was emailed to you, and we'll go by it. Mr. George? would you
No,
mind?
I'm good. You could
Would
stay
you
more
mind-
than 6 feet away.
Okay. I don't really want to throw it at Mrs. Powers.
Thanks.
Thank you.
I have an alcohol wipe if anybody
I
needs it.
have one too, I just wiped some papers
I
off.
do too. Does anyone need one?
Okay.
Okay, so in your
Yeah, I'll
packet.
take one.
Here.
Oh, he wants one.
Oh, he's got the whole box. I don't want to touch it.
Wow, be careful. Good thing the sheriff's here. That might get a whole container of wipes, right? People. Anyone else? Okay, so the first handout is the memorandum that was uploaded for the agenda item. And I put this memorandum together after the insurance committee meeting, where the committee recommended all of the different pieces. We've been doing this since January. We've had a timeline since January with the RFP. Purchasing put out the RFP, and we did almost every line of coverage except for voluntary things like AFLAC. Everything was put out to bid, which was a recommendation moving forward with the insurance committee, and we were able to put that together in a very good outcome. As far as the RFP, the district will save $179,000, almost $180,000 in premium. And the employees, with the recommendation by the insurance committee, will be saving $1.2 million annually in premium. It includes enhanced benefits, which I know we've talked about in my prior pieces that we've put together to talk to you about. Both committees, the RFP committee and the insurance committee, endorsed implementing a 4-tier structure. So on the first handout behind this memo is the 4-tier structure. It's got the open enrollment logo and it's got a blue ribbon on like the top of it. And the 4-tier structure is what was recommended, as Karen Rezzanini, the teachers union president, recommended or advised you. It was 14-0 on the committee to go to these 4 tiers. There is pluses and minuses with regard to the tiers. So we wanted to show that and the impact based on the employee, based on employee spouse and child and family. So we've heard today information about $1.2 million in savings, and that comes from our current rates being dropped not only by the 5%, with regard to remaining with Florida Blue with their new fully insured product and taking the dental, which is an additional 1% deck, so it's 5.1% with both, right? Or 5.5? 5.5. So we took that, looked at the proposed rate, which is the 4-tier, and just on the financial impact, it shows you that employee-only coverage, where we have approximately 1,400 employees, are going to get a $50, $56 a month decrease in their premium, or 66% savings. And also by able to slot employees and spouse, or employee and child, another large group of employees, but not as much as employee only, will receive not only that 5%, but also a decrease with the 4 tiers, because now, as we discussed before, we're right-siding that premium. So those, based on the members that they're covering, the premium covers those members. And then we reach the family coverage, where the current rate and the proposed rate show, if you're on the HMO, it's $174.34 a month for that family. So we put that in red because it's obvious that is an increase for our families. So one of the things that risk management wanted also to look at is there is a comparison, and I don't mean risk management as a whole, but the insurance committee's recommendation is St. Lucie County, our neighboring district, offers a high deductible health plan similar to what we offer. However, their health plan, the family coverage is $1,200 versus our plan, which has a lower cost for deductible, family deductible, out-of-pocket max. It's $794.63. So our neighboring county, where we do get recruitment from, has a more expensive plan, even including the family as their less plan, and this is our high deductible health plan, which is richer. We just kind of wanted to show you that comparison. The other thing is that our neighboring counties all have either 3 or 4 tiers. Indian River, St. Lucie, and Palm Beach. Palm Beach has more tiers because they offer different types of coverage than we do. There was another question that I've had, which is how has this been communicated to employees beyond the unions endorsing the insurance committee's recommendation and talking to their members. We put out a flyer on February 26th that's called Let Your Voice Be Heard. That's in your packet. To District All, which is all employees, about coming to the board workshop as well as coming to the board meeting regarding the insurance committee's recommendation that we would be moving to the 4 tiers. After that information, we had 2 principal and directors meetings where I provided via email to principals and assistant principals the packets that were provided to the board at the workshop for them to disseminate to all employees at the schools as well as the sites, so everyone would have the insurance committee recommendation packet and have an opportunity to review it. And I can tell you we had a number of questions in our office on how does this apply to me. So we spent a lot of time answering employees' questions once they received the packet from their school site administrator or their site administrator on how it would apply to them. So I wanted to let you know we did put it out. We feel like we did the best we could to get it in employees' hands, that we will be looking at the 4-tier structure. The other piece in here is the strategy for the 4-tier insurance coverage education. We felt like if this does pass, we met as a team, what can we do to help families look at this and see what is the best thing for them. So we would have a district-wide email informing employees of new coverage tier options and how they can contact the benefit department to assist them. We'd also use social media. As you know, we are very good at doing movies and risk management, and we will be happy to do that. We have a very good website. We have a lot of information on that. We can utilize robocalls, group employee education presentations, which will be virtual, as well as one-on-one Zoom meetings. We'll have to do all of this virtual for open enrollment. And employees that are currently covering both a spouse and children, in addition to all the district strategies above, will have individual phone calls from the benefits department, email and mail the other coverage flyer, and hold group meetings at centralized locations, and actually they can now be virtual with our Florida Blue representative, who we will remain on site for our employees. Also, we had put together It's Good to Have Options. It looks like this, of what the different options are available. Covering a family doesn't mean family coverage, need to mean family coverage. And one of the things we've found in looking at it is some employees ahead of time have started looking at Florida Kid Care and calling me back and letting me know they didn't realize it was so much cheaper. They got their doctor, they got a plan, and it was cheaper even than the family coverage here, because if you're an employee and you're just covering a child, the family coverage was much more expensive than what was available on Florida Kid Care. So that was interesting to know that we've had employees already checking into that. So this is just a sample of a flyer. And the next one is some sample communication about our discussion with the employee, letting them know what would change, and some scenarios with family coverage and both spouse and children. So we've worked together. There is some other pieces attached to this, scenarios for employee and family coverage, covering both a spouse and a child, and what that might look like. So we spend a lot of time in the benefits department trying to put something together, so we want you to feel comfortable that you have all the tools in your kit. This is the tough decision. I want you to know that we understand. I'm presenting your insurance committee's recommendation as well as the RFP committee recommendation to you today. And if there's anything else you think I can answer for you, I would be more than happy to do it. We stand ready to put together whatever the board wishes today to launch this for our employees as soon as possible. We're very excited about the savings that the insurance committee put forward to the board for the employees at $1.2 million, as well as almost $180,000 that the board will save and could direct for future premiums should they wish.
Any questions from the board? Comments? Anybody want to go first, or I'll go? It's up to you guys.
No, I have some questions. So looking at the different plans, it takes me a little time to digest this, and I appreciate the meeting last week. And as digesting it, I started running some numbers and seeing, we all get happy where we're at, and we all get comfortable in the things we do and the way we do them. And when it comes to health insurance, we have HMO, we have high deductible, and we have PPOs, and there aren't many people when I look at probably the place where it's really going to affect the most, which is the increases. So it's just you've got 132 people on the employee and family, on all three plans, is where the three people will be, the three groups that'll get affected by the increase versus the decrease.
Right?
So when you look at the increase and then the decreases to everybody else, makes that gap pretty dramatic. I can understand, and I look at myself, for instance, my wife, my family, and I, and you know, we like the PPO. It's a good plan. Our doctors are on it. Everything's great. You know, we're one of the 23 people that are set up in that plan. And, you know, can I afford the increase? Thank God I can. It'll come out of my paycheck. But the fact is that it's not fair when you have somebody saving $353 a month. All right, maybe only 9 people in a PPO, and $262 for another 11, and $68 for another 212. That just makes the problem worse of the increase. You follow where I'm going? So it's a big nut to crack. I have a business, so I run my own business. I can afford to pay for a little bit more of this, but the teachers and families that are here, they don't necessarily make that kind of money where they can afford, a $200 increase, while all their friends and associates that they're working with are enjoying, from $60 a month to $350 a month in savings. It kind of makes the playing field a little excessive differences in the playing field. So I'm trying to figure out, okay, we could say some people could change to an HMO. And if it's an employee and family, change to the HMO. I'd like to know, I've never been on an HMO. Well, it's probably been 30 years since I've been on an HMO, but certainly I'd like to know the differences and, can they keep their doctors? Is it, what is the difference for the employee and their family? Not a lot of people do the high deductible, so that's such a small amount of people that that may be separate for me. But the HMO, from a PPO to an HMO, if I have to look somebody in the eye and say, okay, if you can't afford this or I can't afford this, I'm going to go to an HMO. How's that going to affect me? And my family and my doctors.
Do you want me to answer that or no?
Sorry, it was so
I can take them
long-winded.
one at a time. No, we're here for this.
No, go ahead. Yeah, you can answer Mr. DiCelisi's questions and.
Okay. So on a provider, we're staying in the Florida Blue Network. If the sample you're giving me is going from the PPO to an HMO, all of the doctors are going to be on the network. It would be if you move from the HMO to the PPO, just like knowing that the dermatology group in the county doesn't take anybody's HMO. But you said moving from the PPO to the HMO. So doctor-wise, I don't think you have a problem. And we have our Florida Blue on-site representative, so in our strategies is for her to meet with individual families in a closed door or closed Zoom meeting so that they could talk about any individual conditions, pharmacy. We've done this with the retirees. We met handily, Sandy Eckhart met with 200 and some retirees and went over these difficult pieces because we did a similar right-sizing last year, which was difficult. And our team worked very hard reaching retirees and explaining other options. In a lot of cases with the retirees, the options were better. They just were afraid to leave the district's plan. So I understand that the increase is more, and there is some district savings, so that would be a board thought.
Well, I understand overall there's a tremendous savings to the district and the majority of the people who work in the district.
Yes, sir.
And that's a good thing. But it's still a considerable amount of people that would experience, even if it's an HMO and it's $174 a month, that's a lot of money when you're feeding a family.
Understood.
And I just don't know if there's any way to level that playing field. Is there a way we could utilize some of it? It's about $354,000 a year based on these three categories, if my calculations are correct, and Lee's probably calculating it right now.
I was looking at more of like $200 a month, right?
Well, when I looked at I took each category
I'll
and
let you do that, Lee.
I took the increases in each category
Okay.
times the amount of employees in each category, totaled them, per month and then times it by 12. So,
Okay.
yeah, I came out with $29,000 a month, which was about $354,000 a year in increases. So I don't know, is there some way we could utilize, and I know our rebates or whatever we call them, our dividends are not guaranteed what the amount would be. They change every year. Sometimes they might cover it, sometimes they not, and I don't want to have to dip in to reserves to cover a refund that we didn't get, that we thought we were going to get, but
Well, the pro share for this year is guaranteed at the 200,000, July 1, 2021, correct? So our mechanism, since we're fully insured, is the pro share, and then the medical loss ratio rebate. We do get that on an annual basis, assuming our claims are good. We have in the past gotten that. So, that could be our neighboring county, Palm Beach. They do offer employee payment for but they also put in more for family coverage. So that is a neighboring district that basically looks at a tiered structure for how the employee chooses the plan. And if they choose family coverage, there is a little more of a contribution. I mean, since we're comparing St. Lucie, we can look at Palm Beach as well. And I think that's kind of what I can just recommend that Palm Beach does that differently in their next county. So they have a tiered structure for that financial. And it's a tough thing to look at for us. It seems like the committee wants to look at it every year. I know in the workshop I mentioned at least 10 times. So the unions feel like it has merit, and I know Marcia was there. She listened to their comments. And so it's almost like, how do we do both? Because this is very painful too. And so I feel like as we talk about this, we're more than welcome to help you walk through it with different scenarios. However it might work out, we understand it. But we do know that with this, we are creating that recruitment piece in one way where we have a zero cost benefits. And we were also thinking in our office, there may be someone's spouses who lost their job, and in July 1, they're going to want to add them, and they can't afford family coverage. But if we had employee plus spouse, they could add their spouse. And I know a lot of people's spouses who've lost their jobs right now, if they're anywhere in the serving industry and a hotel and all kinds of different places. So that might not be true in July by the time we get there, but we were kind of roundtabling what else could we talk about.
That happens to traditional families too.
Exactly.
Their spouses lose their job.
Exactly.
So, I mean, it doesn't just impact one group over another. So,
I'll let somebody else go until, I'll ask another
Okay.
question later. Let somebody else.
Ms. Roberts,
I'm
did you?
thinking.
So, knowing that the district's saving 179.5, right?
Ma'am.
So I ran the numbers against the 155 people on the employee plus family, assuming there's no migration and everybody stays the same, right?
That number went down drastically. It was
Well, it-
205 or 209, something like that?
Well, it depends on enrollment. It depends on, the two board employee family are not on this sheet as well. We have, I'm not sure how many of
So
those.
it was
but-
230 before, but that's when it was combined with the two family employee people. So when you separate those out, it's 155 and 75?
Because those employees are getting two contributions.
So that,
Right.
Yeah.
so anyway, when I do that, when I take the 155 and the 75, two family employees, or two family participants, right?
Yes, ma'am.
If you, as the Karen Rezaniti spoke, and as it was suggested, if you took $1,000 and gave $1,000 to anybody who is an employee plus family, so that 155 people, if you gave them $1,000, and then if you took the two-employee family and you gave them $1,500, right? Then you divide it by 12 and figure out what their increase would be, right? Mm-hmm. So what you're looking at then is, you're looking at, in the HMO, and the cost of doing that is $287,500 based on those numbers. And out of the 287.5, remember, the district is saving 179.5. So it's less than 100,000, right? I'm not going too fast, right? So if we took the savings and did something along those lines, and then threw in another 100,000 to make a plan where if you were an employee plus family, there's an extra $1,000 thrown in by the district. If you're a 2-employee family, you get $1,500 thrown in by the district. If you were in the HMO, your monthly premium would go up by $92 if you were a family. If you were in a 2-employee family, your monthly premium would go up by $50. If you were in the high deductible, your employee and family would go up by $81, and your 2-employee family would go up by $39. If you were in the PPO and chose to stay, if you were one of the 24 participants who chose to stay in that plan, because obviously if you went to any other plan, if you went to the high deductible with a health savings account, or if you went to the HMO, you would be saving money as well. But if you were the 24 people who decided to stay in that plan, they would be going up by 130 if it was employee and family, and up by 88 if they were the 2-employee family. So I think that makes it more manageable and not as realizing that you can immediately, I mean, my suggestion, and I know everybody's health situation is different, and I know that people don't like change, especially our employees. Nobody likes change. We like everything exactly the way it is. And there's many people who are in the wrong plan. They're in a plan because that's where they're comfortable at, and they don't realize. And I think it's laudable that your department is willing to meet individually, because this isn't a big number. 155 and 75 isn't a big number.
No, we did
And
it last year with over that.
And to meet individually with each of those people, and to view what your options are and what your claim history is. Because I do think a lot of those people, their claim history is such where they would benefit from moving to a different plan and not being in the plan that they're in.
Right,
you know?
that's a tool that Mrs. Wilson, our on-site rep, uses. She's the only one that can see their claims.
Right, and looking at, so for instance, if you were an employee and family, using the numbers I was using with the $1,000 and the $1,500, if you were an employee and family, and you're currently paying $708, right, Mike? $708. If we did the $1,000 spread over the 12 months, instead of paying $708, your premium, if you changed to the high deductible, would be $712. So you do still have some options. If you stayed where you were, your premium would be $800 a month, just so that. But I think that's something I think that,
So you're suggesting that someone go from a PPO to the high deductible plan to save $80?
no, I'm saying that,
$78?
no, I'm saying that I wouldn't, but it depends on what your claim history is. I mean, obviously, if you're sitting there and you're not using insurance at all, I mean, you know,
Yeah, but who's with the family never uses their insurance?
Right.
Hardly ever.
Right,
So
right.
that's, I can tell you, I was on the high deductible plan and it didn't work. Wasn't, the premium was less, but then you take the savings and you put it in your HSA, it doesn't, you're still paying more out of pocket
Right.
than,
right.
yeah. So it has to
I
be.
mean, I think, but what that ends out doing is, if we did something along those lines, the increases would be 92 for the HMO, 81 for the high deductible, and 130 for the PPO. For the 2-employee family, it would be 50, 39, and 88, just with those numbers. And the cost to the district, if we use the savings, the 179.5 that we had in savings, it would be less than $100,000 additional.
Which you're aware you have had us, I use the word earmark, but there is dollars that is in operating that Audra has placed, from last year's ProShare and medical loss ratio
Sure.
that the board's aware of.
Ms. Steffenthaler?
I'd just like to hear what you have to say. I had sent an email to Julie kind of along, I don't have that mathematical ability that you have, but along the same lines of trying to look at decreasing, the employee and family plan. But I'd like to hear what you have to say since you did attend the meetings. But I agree with what Mrs. Roberts is saying at this point.
So, Mr. Anderson?
Yeah,
do you
I
have
would
anything?
only be echoing what Mr. Dietrich-Leasy was saying, and I mean, it's, anything, it's just stuff.
So I did participate in the meeting. I didn't say anything. I didn't participate because I have a very different opinion about this. went with the makeup of the room. There weren't a lot of people that were have a family, are insuring an entire family. So it naturally is going to go, you're going to look out for what is best for you. I had the same conversation last year, and I'm the same as Mike. I can afford the increase, but a traditional family of 4 can't. A teacher can't take on that additional expense. And I'm sorry. I just feel like traditional families all bear the brunt. And I said it last year and I'll say it again. I'm tired of it. I am, it's like you're penalized for, being married, and having a spouse is just even more expensive. And then you add children to it and you stay married, and it's like, I think it's wrong. I think that I don't support such a huge increase. Maybe working off of that to lower it, but I still think $130 a month when you're making $36,000 a year is a lot. That's a lot of an increase. Plus, you're already having those dollars taken out of your check. It's a lot. I don't know what the answer is. I know that we have, whether we look at what does that look like if we do increase the subsidy for certain family coverage and family plus a spouse or whatever that Ms. Roberts was, her math that she was doing. But when we do that, and my question was, so number one, I have an issue with us even talking about this today when we have such limited access by the public, because this is a very hot topic. I do not think that employees were notified, that they truly understand what's going to happen to them, that they really got the information and how it's going to impact them. And while we say, oh, it's only 130 families, well, there's at least a child and a spouse that go along with that. So that's times 2, 3, or 4. So there are a lot more people that would be impacted than just what it says 125 or whatever the number was. So I take that into consideration as well. Besides the, the traditional husband, wife, and family, when you probably add up those insureds, it probably is close to half of what we insure in this district. And I have a problem with it, especially in the climate right now that we're living in. I know that many families, their spouse is unemployed. I saw some of the options, and I've gone out to the marketplace for myself. It was anywhere between $24,000 and $28,000 to insure my family, and that was dropping one of my kids. It's not feasible. It just isn't feasible. And it's not feasible for our employees who make far less. It's just not right.
Could I ask you a question, Mrs. Powers, based on your meeting? I think you said something at the very beginning about the people who made up the committee. You said many of them were not. They are representing that they had families of their own, or they did?
The majority.
I'm just trying to understand how it was unanimous, because that's the committee that I'm depending on to kind of look at everything. And I'm not saying that wasn't unanimous. I'm just trying to understand it, because then it comes to us as a school board after they've been given all of this information and they vote on something. And I'm trying to understand why it was unanimous. Who does make up that committee? And are there people on that committee looking out for every sector, like the families, the employees, I mean, that's what we need to make sure of. But whether that...
I don't know. I don't appoint anybody to that committee. That's totally the unions. I think there's a union. There is a committee member from the Taxpayers Association. Tom Campini sits on that.
The MCA.
MCEA asked me.
Has 3. AFSCME has 3. MCASA has 2, and the superintendent has 4, I believe, representatives. So there is two people on the committee that are 2 board employee families that have children. There is one that is a family and has to cover her spouse because he's self-employed, and she voted for it. She felt like she was helping those 82%. That's what she said in the meeting. But, this is the committee recommendation. But this
There's-
is a board decision, so I want you to know I'm going around what we have. Your other option is to stay with 2 tiers and move forward and look at something else right now, today.
Well,
And then the other thing is, I'm guessing, one of the things is that I got an email from somebody that was very happy about the way this went, because they felt like, that those that don't have a family have been subsidizing those that do have a family. But then, of course, I got emails from people who are part of a family, and I had all of my family on the plan. So, and I right now have my husband on the plan. So I understand how it can hit you. So I am concerned about the family plan, and I think that there's a lot of different scenarios that you can take, and it's, no matter which scenario, the family plan is getting hit pretty hard. So I think, I would like to see us, if we have to, and I understand why you want to go to 4 tiers, so it's not anything about that. But if we as a district can subsidize the family plan in some way, I would like to see us move in that direction to help the families not have such a hit. But I also understand that, the others should have a savings because they have been subsidizing, and I understand that too.
May I?
Oh, yes.
As far, for everybody else in the organization, I think it's great. And I'm glad we could finally get there. But it's just a fairness issue for me. And not for myself. For the, 200 and some odd people that, or, 175 people or so that are going to be paying more money. It's just not fair. So I'm okay with doing subsidizing that. I don't know how that works with our unions. If they're all getting less, I think it's only fair that during a time when the insurance costs more to the family who, in many cases, can't afford it, especially, the big numbers that I'm looking at, I got to believe that there would be some willing. It's not going to cost them anything if we were to subsidize it through the savings or through the refund, the rebate program, or whatever you call that. I'd be interested in that. I'd be interested in what Ms. Roberts said. I think that makes a lot of sense. Even if it's some savings for those folks that choose to stay where they are, whether it's the HMO or the high deductible or the PPO, let them stay there. And if they see some savings, maybe it's not a $200 increase, maybe it's a $100 increase. At least that's more palatable in times when most people's insurance rates are going up. Fortunately, we've been in this position this year to hold the line and see some decreases.
Right.
Maybe there's some things we can do in the future that could get all of our rates down.
Well,
And I like.
there
what you
was an
said.
overall decrease this year in the rates.
It was an overall decrease.
It was just when you move to that tiered system, you really see where the differences are and who's paying for it.
Yeah, and let's face it, a family, there's more people. So you're insuring more individuals under that employee.
Possibly, but you could
Possibly.
be a one-parent household with 6 kids, and you're paying that rate of a parent plus children, or you could be a 4 or a 3 family household, and you're paying the family rate.
Right.
So,
Or you could be insuring your grandchild, and your adult child is not 26 yet.
true.
So,
And may I speak? So, and also looking at, it's good to have options. I think, I don't know, Florida Kid Care, I've always heard there's a difficult time for parents there's a waiting list for that. Is that correct or not correct?
Well, we've checked into it ourselves. Our plan, if we were going to be able to do face-to-face, was to have a Florida Kid Care representative at every open enrollment meeting as part of our team that goes to every school before we went into Captain COVID's environment here that we have now. So we have a Florida Kid Care representative that's assigned to the Martin County School District. I know some members of our leadership team that don't have a spouse have their children on it.
Okay, so maybe it's not as hard to get.
No.
And I know a lot of spouses don't have medical, that's why they're on the district's medical a lot of times. And then the Marketplace, my daughter's had to go on Marketplace, and it's a lot of money to go on Marketplace. And my husband, when he wasn't on my plan, was paying catastrophic. I mean, he was paying $6,000 a month for nothing because
For
they
nothing.
really didn't give you anything. I like the idea of what Mrs. Resiniti was saying about Palm Beach, and I'd like us to look at that in the future in terms of the way they're subsidizing the different levels, like the employee. I'd like to look at that in the future, but still, my feeling right now with Mr. DiTerlizzi and Mrs. Roberts and both of you sitting on the dais is that we need to find a way to subsidize the family plan because it's just too expensive the way it's.
Because even with the Florida Kid Care, I mean, there are options out there, but it's just, and maybe it's just signs of the time, and it's not just us, but it's just, I guess, the affordability of healthcare. But isn't it a shame at this level that you can't find anything really decent? Like Mrs. Powers said, you look at the salaries of what people are making, it's impossible. It's impossible. I just don't know.
So what would that mean? One of my questions was, because I don't think that we're sitting in a room by ourselves, the employees are hunkered down to learning how to teach remotely. And I don't think that, so I asked Ms. Sessa, and I didn't get a chance to talk to her before, and I apologize, so you can share your answer with all of us, was
Okay.
what would that timeline look like if we said, even if we had to come back for an emergency meeting to give time to come up with maybe some different alternatives, maybe the subsidy piece of it to at least lessen it? The sting, I think if we move forward without exploring all those options, it'll be set in stone, and that's what's going to happen next year and the year after, and we will be less likely to make that change. So I would like to be able to explore that this year. So if you could share with us.
Well, I
your-
talked to my team, and Dustin, do you want to cover that? Because I know you talked to Sandy a little bit about it. Sandy helps quarterback our Huntsville School back.
So to answer your question, the drop dead date for us to get a final decision would be April 13th. That's basically backing into an open enrollment period starting May 11th. We need 4 weeks from the time we get a final decision to when open enrollment starts so that we could program your Bentex system and create the documents and implement on time. So to answer your question, April 13th is the drop dead date for a decision. And that's basically pushing back open enrollment about 2 weeks from the current schedule. Yeah.
And understanding if it's going to have to be completely virtual, from what we know today, we won't be able to have face-to-face meetings, but
And that's concerning to me as well, that we're going to have to do all of this in a whole different way than we've ever done it before, given the circumstances that we have, that I don't know what the participation is going to be like if we have to meet virtually with, if, Ms. Roberts?
So I'd like to maybe suggest that we take a 5-minute break so that you can check these numbers, because the numbers I'm coming up with, if we completely held harmless any employee and family in any 2 Martin County School District 2 employee family, if we held all of those harmless and held them at the same rate for next year, okay? And not do the 1,000 and 1,500, but just so we know what that looks like. If we held those at the same rate, not saying that you can, if you're currently somewhere else, you can change to one of those, right? But if you're in that plan, that's where you want to be. And even though there is probably some education that you might want to be somewhere else, but if you're in that plan, whatever the rate is you're paying, what the rate will look like when you're playing it forward, I'm coming up with just under $500,000. I'm coming up with $478,944. And then if I subtract the $179,500 for the savings to the district this year, it looks like about a $300,000 price tag. But I'd like to take maybe a 5-minute break and let them run the numbers just so that I'm not, my math might be off.
Okay,
I don't think it is, but it might be.
probably not, but we can do that.
So could
We can take a 5-minute break. Perfect.
Okay. So you know what I'm...
I do. Go run.
Okay, thanks.
Scenario of keeping family and two-member family costs the same as current, assuming the current enrollment, that would be about a $511,612 per year increase in the district's contributions. So if we subtract the $179,000 current savings, that gets us to about a $332,000, $112 increase to the district.
Would you repeat the number again, please?
The last number?
Yeah, three.
Repeat all of them, sorry.
You got it. So it would cost the district an additional $511,612.80. If we subtract out the current savings to the other lines of insurances, which is
$9,471.
$9,471, I had $179,500. We get $332,112.80. $242?
Because you rounded it to 179.5.
I did, yes.
179,471.
Yes.
So you subtract 471 from 613, and it's 242.
Why 613? I thought it was 511.
241, 142.
Can you repeat those again now?
So 511, 612 with
Got
the
that.
cost to remain the same, minus the
One
cost savings of 179, 471.
Okay.
And then but his was different. It was 332, 143.
142, yeah, 142, 142.80. $332, 142.80, Justin.
So that would be the cost after savings to leave those that were most impacted whole.
And that's assuming no plan mitigation and none of those people coming out. I mean,
Right.
Right.
But I would still suggest, if we can do that, what does that look like? Do we need to negotiate that? Like, how do we get to that point if we can do it? But the other piece is if we want to do this over the next year to get away from, are we going to try to get away from the PPO? Like, what are we doing so that we are still meeting with those families to discuss their claims, what it looks like, should they move to a PPO? Because I do think there are a lot of people that don't understand the high deductible plan, that are healthy, that maybe have one, even in the other tiers, offering that. I think it should be put out to everybody over the next year that you get an opportunity to have a one-on-one meeting to go over your insurance. Because it really is a good thing to go through. I personally will go through it because I think until you understand, and two, with the high deductible, I mean, granted, it doesn't always work out that you have enough money, so you are paying maybe a little more out of pocket, but you're also getting all that money tax deferred. So you don't pay taxes on your income when you put it in your HSA, so that's kind of nice.
yeah, and I do think that, so most people, like even when they get their homeowner's insurance renewal, they hold the two things up next to each other, look at their repairs, look at what they've done, figure out which things have increased, which things haven't increased, and where they can, right, potentially make a savings, like changing the 25% to 50% for zoning pieces, that.
For the most part with homeowners though, most people who, unless there's something catastrophic that happens, the claims are usually,
No, but I think.
don't make claims very often, so.
Right, but I think in today's environment, that's the world of insurance. I mean, I think that's, the same way it's judicious to do that in homeowners, the same way it's judicious to do it with your auto policy.
Oh, absolutely.
Since it renews. It's very.
Your life
and it's
insurance,
very
your
wise
auto, all of
to do
them.
it with your health insurance and to have actual people who are willing to help you do it and to look at your claims so you don't have to go back and figure out exactly how many times you went to the doctor and which prescriptions you got, et cetera, because that information is all available to you all. So I think it is an exercise that's worth it. I mean, at the end of the year when you're putting all your tax stuff together, you may be pulling that stuff together yourself, but I don't know whether most people go through that exercise or whether they would,
Well, it's available on the Florida website, should they log in, and you can pull out your pharmacy and all your medical for all
But
the
it-
dependents.
But it's understanding insurance, it's daunting to someone who does not understand and doesn't know where to go to get those products that we're talking about too.
That's why we're more than happy to do.
can you tell how many people have accessed that, just to look at all their claim history, et cetera?
If they access their own
Yeah.
information, we can get data on how many employees went onto the portal, but we can't dive down into whether or not they actually went onto their EOBs to check that.
Oh, okay, it doesn't.
Just logins.
Give you that metadata.
Correct. But just to add one more little note in that, I think historically HMO has always had kind of a bad stigma to it. HMO historically was a plan that was gatekeepered, meaning that you'd have to get a PCP referral, right, to get everything. But nowadays, HMO is a PPO without out-of-network benefits. So as long as your provider is in-network, the HMO is actually by far the richest plan that the district offers. The PPO is for those that may have children out of the state that aren't in the network, or, you know, the retirees, that's common to see that. But if you're, most part pharmacies are in-network, but if your provider is in-network, it makes sense to go to the HMO. The second piece is on a high-deductible health plan. Those plans are meant for the healthy. They don't utilize the plan historically to make that decision. The concept there is plug the savings away into an HSA. If you have a good year, or, bless you, if you have a good year or 2 years, those HSA funds that you don't use roll over, and they build and build and build, and before you know it,
Your hand.
they're covering your deductible. So I just wanted to add that in, that there's a lot of education that goes in with plans and picking plans, and we find that members will tie an HMO bad. High deductible, it's a high deductible, bad. But in reality, it fits, you know, a particular employee.
And that goes back to the same thing, that when you look at who they're using for you look at a family that lives locally, who they're using for doctors, what they're doing, and what their medical claim history is. You'll find, in some cases, they would have been better off to have been in the HMO. I mean, just because they're not out of network. They're not, it's just your normal pediatrician, et cetera, those type of things.
So, and I agree with what you just said, because I was on an HMO and went to a PPO because everybody touted how great the PPO was, and then I had to have surgery, and then it cost me more being on the PPO, so I went back to an HMO, so that people don't realize, because HMO did have a, sort of better. The other thing is, Julie, I don't know if you're still doing that, but when I was still working, people didn't have to come in if they didn't want to change their plan. Like, they didn't really have to come in and sit down with somebody. And I think with everything changing, I think everyone should be sitting down with somebody to kind of go over what you're saying. I don't know if you're doing that
Well,
now.
what we have presented is a mandatory open enrollment. I actually recorded some of that today on a voiceover, as our team has been working with some of our media specialists to work on how to get things out, and it's gone really well. So as much as we can, we've gotten it as much as 87% of our employees to go in and Ventec, because our compliance notices are in there, our information, our memo, our change memo on what's going on, and then we go site by site for one-on-ones.
Right.
But we could still figure out how to do a Zoom one-on-one, whatever that might look like. I think, even though it's difficult for us, I think having a large number of our staff on Google right now, we will be able to use those tools for open enrollment, for virtual open enrollment, because they're going to be in front of their computer, not having to watch children right behind them or in front of them. So we're hoping when they're off, they're comfortable with Google, and we'll be able to use that environment to our advantage for virtual open enrollment.
Encouraging them to meet with you that way, because
Yes.
I think I need education. I mean, insurance is very difficult to understand. So if we encourage them to meet with somebody, you might be able to get them to change some of what they're doing, basically, because a lot of times I think people weren't coming into this, we're just going to leave it the same. And I think it's easy to leave it the same. However, they're not getting that education why maybe that's not the right way to go. So.
Well, and some other things that we really want to push is with what the committee's recommended is the life insurance and the short and the long-term disability are going to be what they call a true open enrollment, or what I call it is you don't have to give your medical history in order to come on. If you want to buy it, you buy it. And so with the change in the carriers, there's people that were harnessed and maybe one year they get 10,000 more and the next year they got 10,000 more and they really needed this, but they had to keep inching up. Now they can buy this as long as they can, something they wanted and they can just walk right in and get it. So that, having that benefit is really important to be able to get to employees who, oh, I can't get on that because I have to do an evidence, or I have to tell them I'm diabetic, or I have to tell them about my other chronic condition. They don't have to do that. So that's the other thing we really want to beat the drum with. If it's something you wanted, this is a good time to buy it. So the other option that we can, if you want to look at numbers again, we do have the two-tier. We brought it if you want to look at those. That was not the committee recommendation, but if they looked at both, and we have that option as well.
And there was still a savings with the two-tier, correct, Julie?
There is two, yes, there's still, because we got the 5.5% decrease in premium, so yes, all employees would get that decrease, because we're not moving, we're not right-siding at that time, we're keeping it the same. The other thing that.
You said you brought it, do you mind, I mean, I would just like to look at it. I don't know if anybody else wants to look at it, but let me just look at it.
So what does it mean, just while we're waiting for that, what does it mean? How can we implement this with the cost of $332,000? What do we need to do as a board? Is that something that we want to explore? Is it something we need to address between now and April 13th, obviously?
Yeah, so what I
And-
would think that we would have to do is, thank you. So what I think we would have to do is,
That's not.
we would have to obviously negotiate that piece. I really can't perceive that that would be an issue, and then,
Well, you're open with AFSMI right now, right? Mrs. Gaylord? Or that they have
Wrong one.
an AFSMI, you're still open with AFSMI?
You need him back?
Eagle.
Sorry.
So you have that avenue and.
Sorry.
You do have that one. It just shows you what.
I think as far as a recruiting tool goes, I think what we need to be doing is we need to be going to more tiers. We need to be out of the two-tier business. Because I think especially as you're attracting younger workers, especially as you're attracting newly married people, that type of thing, that's where we need to be. And if we can do something and hold those people harmless, anybody who's a family, the traditional family unit, and keep them right where they are.
But, I don't disagree with that we're going to want to recruit. We want to recruit, we're going to have to recruit younger people, but we also, we want to retain those employees that have been here between 10 and 20 years that want to stay working for the district. And if we jack their insurance rates up, because those are the families, those are the people that have children.
And I don't think we should jack those up. I think we should bite it, and we should hold all those people harmless. The cost to us is $332,143, or $142.80, in addition to the savings of the $179,471.
Is that a motion?
Yes.
Second.
All right. Any discussion?
So, hang on, does this have to be negotiated?
Yeah, so it would have to be, it would be what we would approve now, it would have to be negotiated, and then we'd have to, as long as it negotiates out okay, then we wouldn't have to see it again. If it doesn't negotiate out okay, then we would have to see it back to decide what to do.
Do we want to hear from one of our union reps?
Well, they would be the ones that would be negotiating it. So.
Yeah, we probably shouldn't,
Probably can't, right?
Or we can't, I don't know.
Well, she spoke already.
She's already spoken.
but
so I
we
don't-
probably shouldn't directly negotiate now that we have
Well, I
a
wouldn't say
potential
that I
vote
would
on the.
negotiate it. I don't
But
know.
she mentioned in her comment that was an option that the union had presented. So hopefully,
And the option of the 511, 612, 80, less the 179, 471, is richer than what was presented here at the, open to the public, so. As something that was of interest, so I don't think it's, I think we want to encourage people to stay longer, have their family grow up here and stay here. I think that's what we need to be doing, so.
I would be supportive of that. So we have a motion by Ms. Roberts and a second by Ms.
And-
Steffenthaler.
And to approve, and my motion includes all the other,
Yes.
all the other pieces, dental, vision, EAP, life and ADD, and short and long-term disability.
And the seconder agrees, correct?
Yes.
Okay. So I have a motion by Ms. Roberts, a second by Ms. Steffenthaler. All those in favor?
Aye.
Opposed? Motion carries unanimously. So if there are any issues or problems, it'll come back to us before April 13th. We will, if we need to hold an emergency meeting to get that done, we will. Otherwise, hopefully, it'll go seamless with the two unions, and we'll see you at open enrollment.
Awesome. Thank you so much for your support and your time listening to us. We really appreciate it.
Thank you. Appreciate it. Okay, I think that was it. Was our last agenda item. Is there any board comment? Did you have anybody have anything you needed to share?
Not that it's really, I don't for anything that's really important right now, except just to thank the superintendent, the district food service, district staff, instructional staff, teachers for all they're doing, because it's a monumental task, and all of the information, and I'm just reiterating what's already been said, but I wanted to say it also. The PIO, what Mrs. DeShaz has been putting out too in terms of the communication. Thank you for everything. And your partnership with Boys and Girls Club and everybody you're partnering with in terms of trying to pull this off. Really do appreciate it. If there's anything we can do or I can do as a board member, please feel free to call upon us, because we're here to
I
help
gave
you.
them your name and number.
Likewise, if they if they do deliveries, let me know. I'm happy to volunteer as well, and probably round up some volunteers to help if that even becomes an option of things to do. So I would be happy to help with that.
Madam Chair, just so you all know, I am participating in a phone call conference tomorrow with fellow Florida School Board Attorneys Association members. Superintendent Gaylord had asked if Mr. Phillips could be in on it, so he'll also be on that call. I think I've also managed to get Superintendent Gaylord on board that Mr. Phillips should be a member of the FSBAA.
I didn't.
Three of the topics that we are covering is how differing districts are addressing the Family Medical Leave Act, how different districts are dealing with the issue of memorandums of understanding, and how different districts are now moving towards how they're holding school board meetings. So hopefully that'll be informative for both of us. That will help us kind of have some guidance as the district deals with it.
Can I ask you a question also? One of the things I did put on my notes here is, we talked about bringing some, and I know this is an emergency meeting, but we talked about the Arts Council last time, because I know that there were grants and all that they have to apply for by certain dates, and I don't know if that's something that, we need to be looking at in terms of moving forward with and making sure that they're talking to the district, but I just wanted to mention that because we mentioned it at the last one.
Yeah, I actually gave Ms. Falls a list of like 18 items that have come up that need to be followed up on, and that was one of them. We also, obviously, this whole coronavirus has put a monkey wrench, so I do know that a lot of grant deadlines have been extended. So I don't know, we probably should reach out to the Arts Council and find out what their timeline, if that's changed. And if their grant cycle has changed, because a lot of grant cycles are changing because of it.
So who reaches out then?
So I know that Mr. Grabowski, I know that he is usually in touch with them, so I can make sure that he reaches out to them. Also, Ms. Roberts, do you know the grants specific that they would be looking at, that we can
I don't
check
know
to
whether
see?
it's historic preservation or public facilities or something else. I'm not sure which one it is.
Thank you.
Any other comments, questions? All right. This meeting is, yes, wait.
Will we adjourn?
Oh, yes.
Second.
Thank you.
You're welcome.
This meeting is adjourned.
Yeah.
Everybody stay well.
Lori, when you talk to volunteers.